So an eating disorder is really a clinical issue with food. So there are generally three types. There's anorexia, bulimia, and binge eating disorder.
Anorexia is a specific type of eating disorder that involves restrictive eating in particular, and the body mass index is significantly lower than what the average should be. People with anorexia really see themselves as much bigger than other people might see.
Some women or men get emaciated, and that's certainly scary. They're very good at hiding it. They'll wear baggy clothes, or they'll kind of wear oversized things so it looks like everything's fine. If you're sitting and eating with this person, maybe their food just gets moved around on their plate, but they're not actually eating it. Some, when they get to a certain point, your body has to produce some sort of body heat, so becomes a layer of hair that grows on someone's skin. Bulimia is an eating disorder that involves two elements. One is binging and one is purging. So you might eat a ton of food and then you throw it up. Those two things usually work together.
Sometimes with bulimia, you may not see as many obvious symptoms of the illness as you would with anorexia. With anorexia, you generally see a very, very thin person. With bulimia, you're not going to see somebody who's particularly skinny or particularly overweight.
The enamel on their teeth might get damaged because they're throwing up. Sometimes they might have marks on the back of their hand because they're making themselves throw up, that their teeth make marks on the back of their hands. Or maybe they just are hoarding food, and that's just a sign you see that they're just like, they don't share, or they won't give food away, or you find wrappers all over their room or in their bag.
So binge eating disorder is another type of eating disorder that is as it sounds, where somebody is taking in many, many calories in a short amount of time. With binge eating disorder, people might eat when they're already full but continue to eat. They might feel uncomfortably full after they've eaten, and they certainly would want to eat alone because they're sort of embarrassed about how much they consume in how little amount of time.
I think it's really important not to be afraid to express concern. People who are not well will be defensive and fight back. Sometimes some of them might be relieved that you're noticing. So I think we tiptoe around asking if someone's okay when it may be the best thing you could do is to just say, hey, I'm worried about you. Here's my observation, without any judgment. But here's what I noticed. Can we talk about it? And then see what they say. And if you're really worried, encourage them to get to a doctor.
If you're having thoughts of suicide, get support. Call the Suicide and Crisis Lifeline at 988.